When you gotta go, you gotta go. But what if you find yourself needing to go way too often? Overactive bladder syndrome is common, and today on Being Well, we're looking at ways to treat it. Stay tuned.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. I'm your host, Lacey Spence, and today we are welcoming Dr. Millie Nelson, made the trip from Effingham. Thank you for being here.
You're welcome.
And so today we are talking about overactive bladder syndrome. So kind of like when you gotta go, but it's a lot. So what is overactive bladder syndrome?
So overactive bladder syndrome is a very common type of bladder control problem that leads to incontinence and loss of urine, which is uncontrollable. It causes women to have lots of urgency symptoms. So when they gotta go, as you said. It causes people to urinate more frequently. It causes people not to be able to hold their urine when you have that urge. So they get spasms of the bladder muscle. It causes people to have to get up at night to go to the bathroom frequently, so they have issues with getting to the bathroom, and it's very common in older women.
And so what are the different reasons that women can have bladder control issues?
So unfortunately, as we age, the nerve roots of our tailbone control the innervation of our bladder. And sometimes those nerve roots get pinched. So a lot of people get arthritis or spinal stenosis, constriction of the lower spine that constricts those nerves so they are not able to work as effectively. Also, if you have any vascular disease that is occurring, so your vessels are narrowing, the blood supply to the bladder can be decreased. And when you don't have that youthful back or that youthful blood supply, you develop overactive bladder syndrome. It's not something people like to talk about, right? You know, start investing in poise pads, and as it progresses, as you age, it depends that you wear all the time. Getting up at night, if you're elderly, can be very disruptive, especially if you have mobility issues or you have arthritis and stiffness issues. Overactive bladder syndrome is a hugely common problem in people with any neuromuscular disease like multiple sclerosis. And it's way more common, I think, than we are aware of.
Do you have a guesstimate about how many people are impacted by this?
I don't have that number exactly in my brain right now, but I would bet if you started to ask your grandmothers if they have any of the urgency, nighttime urination, frequency, well over 50% of them would say yes. And traditionally, you know, you would go to your primary care provider and they'd say, well, here's this pill. Just take this pill. And the pill is expensive. The pill makes you have a dry mouth. You got to remember to take it every day. Who wants to do that? And it doesn't always work. So we have, for many, many years, not been very good at treating it effectively. or identifying it.
And that can impact quality of life as well.
Absolutely. People make decisions about where they're going to travel, make decisions about how long they're going to travel, make decisions about, where they're going to eat or what church they're going to go to, because is there a bathroom nearby in that church, what grocery store they're going to go to. Very much so.
And as we're taping this in July with everything COVID-19 related going on, I mean, folks might even just be afraid to use the restroom just for
Well, I
catching
mean,
it.
restrooms can be closed.
Yeah.
Like, I don't know, are the rest stop restrooms open?
We'll have to check back in our crystal ball once we're in the future. But we've been talking a lot about how it's impacted women. Does this impact men as well?
It does, but not to the same extent as women.
Is there a reason for that? or
Yeah,
just-
that's a good question.
Fair enough. We're just the lucky ones, right?
Well, I mean, I'm a gynecologist, so.
So overactive bladder syndrome, how do you evaluate it in women?
So a big piece of evaluating it is history.
Okay.
So I ask those questions I just asked. Do you wear a pad? How often do you change it? Do you get up at night to go to the bathroom? Do you have low back pain? Do you have sciatica or pain radiating down the back of your legs? Do you feel like you have a bladder spasm where you're not doing anything, you're just hanging out and it spasms, and then you pee in your undies, and you didn't anticipate it and you couldn't stop it. Then I talk to people about having what's called urodynamic evaluation. It's a study to evaluate the various etiologies of bladder control problems, because not all people have overactive bladder syndrome. That's a little office procedure where you try to reproduce your problem. I want to look at I put a little tube in your bladder and I fill your bladder up and look how much urine can you hold. And when do you get that urge to go to the bathroom? So for example, the average woman should get the urge to go to the bathroom at around 300 cc's. What is that? 2 cups of water in your bladder. Some people, they get it at 50 cc's. They have a little, yes, big difference. Some people have bladder control problems because the tone in their urethra, which is the tube that we pee out of to our bladder, is very poor. And it does't hold it back. It doesn't stem the stern. Some people have bladder control problems because they have a very mobile or hypermobile anterior vaginal wall. One of the other things that contributes to overactive bladder syndrome, for example, is the changes through menopause of the vaginal tissues. So in young people, the vaginal tissues have lots of little ridges or rugae and are very elastic. But as we get old, we get droopy, our boobs start to droop, our stomach doesn't hold it in, our cheeks go down. I say everything goes south, and the vaginal tissues get thinned out and lose their elasticity, and so you don't have that support to the anterior vaginal wall. The microbiome of the bladder changes as we age as well and can contribute to the irritative symptoms of overactive bladder syndrome. So a microbiome is the natural bacteria that are healthy, that should live anywhere in our body, and they're different in different places. So I take a history, and then I propose having a urodynamic procedure. And from there, I discuss with them a variety of different paths that they can go down for their bladder control. So if they have a saggy bladder, maybe they want to do pelvic floor physical therapy, as I talked about the last time I was here. If they may just want to try medication, and there are now 4 or 5, maybe 8 medications on the market for this. The ones that have the least side effect and work the best, of course, are the most expensive, but there are lots of options there. You want me to go into other treatments?
Oh, yes, please.
So then, sort of the new kid on the block is this thing called PTNS, which stands for pre-tibial nerve stimulation. And it's done here in Sarah Bush, by the way, by one of your urologist's office. It's done in Effingham, it's done in Champaign. I mean, you can pretty much find it in any city. And what it involves is putting a teeny tiny needle in the pre-tibial nerve, which is just above your ankle. So it would be similar to a chiropractor, right?
Okay.
And I attach a little current to that, which stimulates it for 30 minutes. And it's a weekly treatment for 12 weeks and can be very, very helpful. And then sort of third line treatment would be, which is even newer than PTNS, is injecting Botox into the bladder wall to prevent those spasms that overactive bladder syndrome patients get. Now, Botox wears off, so you have to do it approximately twice a year.
But I feel like that makes sense where you talk about things are drooping, that you get Botox in your face. It could
I can't give the leftover into your forehead.
Well, and they're using Botox for so many things.
Yes.
Migraines nowadays as
Headaches, yep. It is used for a lot of things.
So if we go back to the PTNS, you said it hooks to your ankle?
Yep. So if I could demonstrate, I put it 3 finger breaths above my ankle bone and 1 back, right there. And I just stick a really teeny tiny needle there. And then I apply a current for 30 minutes. And there's a device you hook up and you kind of raise the number, so the amount you might need and the amount I might need might be different. So we go to the point where you can see twitching in response to the current of my toes, and not so high that it hurts.
Yeah.
And then when you get to that sweet spot, you leave it there for 30 minutes and you come back once a week for 12 weeks.
So how important is it that there are these newer techniques to treat this, and women are, getting to improve that quality of life that we talked about?
Well, so I have a patient, for example, her chief problem was she couldn't play tennis, and tennis was really important to her. She has a group of friends, she meets them for tennis once a week, and she couldn't play tennis without peeing all over herself, and this has changed her life. And in elderly patients where they can't sleep, they can't get to the bathroom easily, and you worry about fall risk, as they get hip pain and knee pain, it's extremely life-changing. They're happy. Yeah. They're very happy.
And so moving forward, do you know of any other treatments that might be coming down the pipes to kind of work on this at all? Or?
Well, so it might be something that can be a multimodal, or using different things together. So I have some people who take medication and that helps them 50%, and then they do medication and PTNS. Or some people that the medication doesn't work at all and they go through the PTNS process and they say, well, it made a huge improvement, but I really want 100%. And those people may choose to do Botox. The way you do Botox is you put a telescope in the bladder, so it's a bit of a surgical, bit of a procedure, and then you look at the bladder wall, and while you're looking, you make 20 little injections of Botox units, little itty bitty units, into the bladder wall. It has a risk, it can work too good, not enough, just right? If you do too good a job, the bladder can't contract at all, and you develop something called urinary retention. And the problem is if you get urinary retention, you have to wait till the Botox wears off.
To use the restroom?
Well, you end up self-cathing yourself.
Oh.
Yeah, which isn't very pleasant. So there's an art to too much, too little, just right. So when I start somebody on that, I might start with a little bit less.
Yeah.
Right? And then you have to do it twice a year to make it work. Vaginal estrogen is another big helper as well. So estrogen alone is only going to produce a very small response. But it's sort of a little of A and a little of B and a little of C, and your life is improved.
So at what point do I need to come see you where it's not just I've just had kids or something like that?
So that's a great question. So the American College of OB/GYN is really focusing on this concept of what is well woman health and what we as gynecologists should discuss with you at each stage of your life. What questions should we ask? So traditionally, when we were younger, we think of going to the doctor, to the gynecologist, and it's either to have a baby or it's to have a pap smear or screening for vaginal discharge of all sorts, or treatment of fibroids or bleeding problems. But really, it's preventive health things, and it's addressing things that occur at different stages of life. So at your age, I'm assuming the have kid age, I'm going to discuss pelvic health in terms of after you have your baby, I think you should do pelvic floor physical therapy to keep those muscles strong. I'm going to, rather than waiting for you to say to me, I'm having lack of lubrication with intercourse because of vaginal dryness as I transition through menopause, I'm going to talk about it before the horse gets out of the barn, so to speak, right? Prospectively. I'm going to ask you when you come as a routine question for preventive health, do you have any bladder control problems? So I'll invite the question. I will also, which is not the topic here, but I will also ask about another even more inconvenient complaint that people really don't want to talk about, which is fecal incontinence. And some of the things that treat overactive bladder syndrome are rooted in the same etiology and also treat fecal incontinence. And there is sometimes a relationship between the two. That's a symptom most people hardly ever want to talk about.
Right.
You know, and sometimes when I ask the question, they go,
yeah.
How did you know?
Well, it can be embarrassing to bring up with your doctor.
Absolutely.
But you're supposed to be our A1 that we can trust with that information.
So,
and as you talk about symptoms being related, a lot of this has been physical. Is there any sort of mental aspect of the I need to go or trying to train yourself to not go as often?
Well, so there is that piece where it's impacting on your life so much so that you're like obsessed about it, right? And you change your life and the things you decide to do. And so relaxation is very helpful. Bladder training can be very helpful. There is a role for mind-body therapy or mindfulness and yoga to help with this problem.
And so I imagine it's something that you would still need to see a physician so that you know that you're doing the right types of stretches?
So I think you first need a diagnosis.
Sure.
Right? So you need to learn about your body. You need to acknowledge your symptoms because a lot of women don't want to acknowledge it. They're ashamed. And then you go through the evaluation process, and maybe you try some traditional treatments first, but you explore the gamut of what's out there. Mindfulness, yoga would not necessarily be prescribed by a physician, but somebody who's got expertise in that, psychologist.
And I know you said that there were risks to the Botox. Are there risks with any of the other treatments we discussed?
So some of the newer medications for overactive bladder syndrome can raise the blood pressure in people who already have blood pressure problems. Some of the traditional, common, least expensive medications for overactive bladder syndrome oxybutynin is sort of the prototypic drug, can cause a horrible dry mouth. So a lot of medications some people end up on later in life cause a dry mouth. So now you've got A plus B plus C, right? I don't know of any negative side effects of PTNS. Although I will say, if you suffer from a peripheral neuropathy, which would be an extreme vascular neuropathic change in your lower extremities, so you can have constriction of the tailbone nerves, but how about if it extends all the way down to your feet? They may not be as effective with Botox, with PTNS. And I guess this is an off-label use, but there are vaginal lasers, specifically the Mona Lisa procedure, that are done in southern Illinois, that rejuvenate the vaginal walls, that are primarily for vaginal dryness, but they also help with incontinence.
Gotcha. And so, I hate to be bleak about it, but is there ever like a point of no return where you just can't quite get those muscles back to how they used to be?
So there is a diagnosis we sometimes make called mixed incontinence. And all of these treatments are going to work the best in somebody with primary only overactive bladder syndrome. But if you have a little A and a little of B and a little of C, there can be multiple things that impact on your bladder control, and your results will not be optimal.
So the next step for them, is it wearing the overnight pads or what have you?
You know, poise pads are a multi-million-dollar business in this country.
Gotcha.
Yeah.
So what's the most common question that you get from patients while they're in the process of being treated?
Common question. I'm usually asking the questions.
That's fair. So do you think it's important that, I guess, the healthcare field is kind of taking a shift to be more proactive instead of reactive?
So I absolutely do. So I think that the beginning of this discussion is not necessarily in my office. I'm a gynecologist. I'm the person you come to when you have the symptom and you've talked to your primary provider about it. I think that encouraging our primary care providers, which is physicians and advanced practice providers in the community, because advanced practice providers see a huge wealth of the primary care, in particular in people as they age, to begin to ask that question about both bladder and fecal incontinence.
And so you don't always necessarily need a referral to see someone like you, or how does that
Well, you don't need a referral to see me. You can just call
Sure.
up, but a lot of people get referred. You know, so like let's say you went to your primary doctor and said, I'm having all these symptoms, and they said to you, well, try this medication first. And you tried it, and you know, then you decided you didn't like it anymore and you went back. And then that provider could say, well, why don't you go talk to Dr. Nelson and see what other ideas are available.
And in our last couple minutes here, how important is it for patients to kind of be their own advocate? Like you said, if they didn't like a medicine or are nervous about a treatment, to be asking those questions instead of just kind of going with typical.
Extremely important. And I would think the people that are watching this show are doing that because they want to educate themselves about their bodies.
So in our last minute here, do you have any advice or parting words that might help someone at home?
Don't think that you have to just live with it. You know, I think that's a key piece. And ask, and don't be embarrassed, because honestly, your friends probably have the same problem. You know?
All right. Well, thank you so much for being here.
You're welcome.
Dr. Millie Nelson, I appreciate it.
I forgot to talk about food.
And we will see you next time for Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.